Hi everyone. This is my informative speech I'm doing for my PS 101 class. And today I'm going to be speaking on informing you about PTSD, which is post-traumatic stress disorder. How many of you have ever experienced a tragedy or a disaster that just left you kind of like having this horrifying movie replaying over and over again in your head? Well, and you thought that it was never going to end, and it was almost like driving you crazy because you kept re-experiencing it, and it was almost like lifelike, like you were right in the film. And so anyway, I'm here to tell you today about what that term is, which is termed today as PTSD, how it came about, its causes and effects, and its treatments. And as you can see here, I have a poster board, and it just says what PTSD, things to know, and what we're going to be discussing, and then the way trauma can affect this to trigger into a person to acquire this disorder. It is a mental disorder. Doesn't mean that you're crazy or should be locked up or anything like that, but it's just something that the American Psychiatrists Association termed it. And that was after they've done extensive research. In 1980 they termed it PTSD because of the soldiers coming back from combat from World War II were experiencing symptoms that were so similar, and their experiences with this disorder, that they did extensive research and they found it to be PTSD. Some of the symptoms can be flashbacks and nightmares, and then it could also be depression, withdrawal, fear. Fear can lead you to withdrawing into isolation, where you just want to like lock yourself up and not see anybody, not have anything to do, not get out of bed, not do your normal activities, daily activities or routines that you normally do because of the tragedy or the trauma that has hit you. It's sometime, one day or another, someone is always facing a trauma or a tragedy in their life. And it doesn't matter how small or how big. It can hit anyone at any age. You don't have to be, an individual who served in the war or who has, experienced combat or anything like that. It can happen to anybody. It happened to me. My trauma or my tragedy was a tragedy of divorce. And I had depression, I had anxiety, I had withdrawal, I was losing contact with my family, my friends. I feared everybody. I didn't trust anybody. I was having flashbacks, nightmares, the whole 9 yards. But if you can recognize the symptoms, and that's what I'm here today to kind of just let you know, that if you recognize the symptoms, then it can be controlled. Not that it's ever going to be curable, but you can control it. As I said, we went through the symptoms. Once you know what the symptoms are, you need to seek help. And the best way to seek help is through your family physician. Is a great place to start. They can, if they're not qualified and experts in dealing with this disorder, then they will refer you to somebody that is. And usually that can be from a therapist, or a counselor can refer you. Like if you're having trouble dealing with it and you seek a counselor to help you kind of get through these problems, then you could be, they could refer you. If they're not able to still help you get through it, they can refer to a psychiatrist or a therapist that is an expert in this area. Some of the treatments that you'll be going through could be one or all of 3 of them. The techniques that they usually use is the treatment of behavioral therapy. And what they do in behavioral therapy is they try to recondition your thoughts, your negative thoughts, and turn them into a positive thoughts. And it's just switching it from the terror and the horror that you felt and the fear into being more relaxed about it, recognizing it, and turning it into a positive thing to make you cope better. Then the second therapy is exposure therapy. And exposure therapy is where they actually expose you back to the scene of the trauma or to the event of what happened in your life to cause you to be in this position or state of mind. And then there's also medication. And like I said, you could choose 1 or 2 or 3. All 3, it just depends on what works for you. Myself, I had the behavioral therapy, and then I also have the medication. And usually they deal with antidepressants to help you through with this. And I had both, and what happened was I became more relaxed, more focused. I lost my focus and everything like that, but the medication helped you gain the focus back. And it usually takes about 6 months for the therapy to work. And after that, it gets better as time goes on, and as long as you stay on your medication or continue with the therapy, your therapist or doctor can evaluate the time needed. And it's not that, like I said, it's not curable, but it helps you to cope with it. And also it will help you as, if you know the information, or if you see somebody that's going through it or experience a trauma, you don't have to be through it yourself. You can witness it and still be having the symptoms and this disorder. So if you see somebody that's going through it, or a friend or a family member or anything like that, at least now you know some of the signs and you're aware of how to help them. So I hope that my speech on PTSD has helped you in ways of informing you about it, and I want to thank all of you.